Om Dhanvantare Namah. Good morning to everyone. I heartily welcome all the participants, dignitaries, resource persons, respected faculty of Ayurveda who joined this second session of webinar series Bala Prana Raksha 2021 National Webinar Series conducted by Sindhagi Shantavireshwara Ayurvedic Medical College and Hospital, Haveri, Karnataka in association with Jignasa, Karnataka. We feel very happy to announce that the first session was participated nearly 500 people through the Zoom Meet app. It reached 1.5k viewers through the Facebook under the page Jignasa Karnataka. Today's session also live streaming on page Jignasa Karnataka. We are very humbled by getting this much of appreciation and response coming from the whole Ayurveda fraternity across the India. The whole today's session, second session is completely live streaming on page Jignasa Karnataka, and you can watch the whole videos of the sessions in the YouTube Jignasa page and also in Facebook page of Jignasa Karnataka. I request everyone for this second session for the participation. Once again, I welcome everyone for this second session, scientific session held by the Dr. Nayan Kumar sir, Associate Professor, Department of Kaumara Vritya, STM College of Ayurveda, Hassan. Topic: Management of Cold, Cough and Breathlessness in Pediatric. We are happy to have you on this session, sir. Please welcome, sir. Let's start the session with the prayer of Lord Dhanvantari.
नमामि धन्वन्तरियाधिदेवो सुरासुरैर्वन्दिते पादपद्मम् लोके जरारुभयमृत्युनाशनम् धातारमीशं विविधौषधीनाम् धन्वन्तरी रमानाथम् सर्वरोगनिवारकम् आयुर्वेद प्रवक्तानाम् वन्दे पीयूषदायकम् सर्वे जना सुखिनो भवन्तु सर्वे सन्तु निरामया सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत्। ॐ शान्ति शान्ति शान्तिः।
Once again, I welcome everyone and all the eminent personalities of in field of Ayurvedic pediatrics and all the participants who joined this webinar session, all the PhD, PG scholars, UG students and HODs of the different colleges of Ayurveda and professors, lecturers who joined this scientific session through this virtual meet. And I'm also heartily welcoming Dr. Anurag sir and Dr. Purushottam sir and Dr. Puranik Mad sir for their active participation in this scientific session. And once again, I welcome everyone for this second session held by the Dr. Nayan Kumar sir. Now I request Dr. Chandrasekhar sir, HOD, Department of Kaumara Vritya, for the introduction of today's resource person to this gathering.
Hello, Kumar sir. Hello.
Hello. So you are audible, sir. You are audible, sir.
Okay. Welcome, sir. It's my immense pleasure to introduce our today's resource person, Dr. Nayan Kumar sir. Sir, presently working as Associate Professor in the Department of Kaumara Vritya, PG Studies at SDMCA Hassan. Sir completed his UG from SDMCA Udupi in the 2008. Completed his PG from Gujarat Ayurvedic University, Jamnagar in the 2012. Sir has completed his PhDs from the RGHS Bangalore He served as an associate professor and teaching experience about 7 years for the UG and PG teaching. And he has a wrote a research articles in national and international in the medical journals, as a resource person and national seminars and workshops, and as a guest lecturer. And he attended many conferences and workshops and seminars in the various seminars. And today the sir will be going to present a topic and approach towards the cold, cough, and in the pediatric aspect. Thank you, sir, and you can start the today's session.
Once again, I'm welcoming Dr. Nayan Kumar, sir. Over to Nayan Kumar, sir. So you can start the session, sir.
Question at the end of the session.
Hello, am I audible?
Yes, sir, you are audible, sir.
Yes, thank you, Chandrasekhar sir, for nice introduction. And in the beginning, I thank the organizers, SS Ayurveda Medical College and the Jijnasa for inviting me to share my knowledge and take some experience from you all regarding Kaumarvritya practice. And at the outset, I want to congratulate the organizer for choosing such a relevant topic in present duration of this pandemic, and it is aptly decided topic for this deliberation series. So straight away, continuing, 1 minute, I will share the screen.
Yes, sir, it's visible, sir.
1 minute. Yeah. So we will straight away start with the deliberation. That is, today we will see regarding the common problems in respiratory system of the child and how they approach to the physician, that is Kaumarvritya practitioner, and what should be our approach for such conditions. At first, we have to know the status of the child, how the child is. As we all know, childhood is a very supple wood, that is very tender age, wherein the dhatus will be aparipakva and child's immunity is less. And of course, Shleshma Dhatu Praya. We are explaining, Charaka was very keen. So he didn't mention Shleshma Dosha. He didn't mention Kapha Dosha. Rather, he is telling Kapha Dhatu. So Dhatu is having lot of other functions than doshas. So he is very clear. It is the developing age. So the positive nitrogen balance, what we see in developing child, so that is referring to as Shleshma Dhatu. It is a growing period. The anabolism is at its helm than the catabolism. So this is indicated by Shleshma Dhatu Praya. Of course, Shleshma Dosha also will be predominant in the early phase of life, that is Balyavastha. So as child's immunity is less, child is exposed to many of the challenges in day-to-day life. So here we are seeing gateway of India. Similarly, the respiratory system is the gateway for our body, for the infections, allergens, for any environmental pollutants, because it is the single system which is in continuous exchange of particles with the outer environment from life to death. So we are very concerned about the first breath of the baby immediately after delivery. So once it starts contact of respiratory system with the external environment, then it is persistent till the death of the person. So that's why the respiratory system is actively engaging with the environment. So that's why it will get challenges, environmental challenges, and it is the gateway of infection. So first system to affect always, especially in children, is the respiratory system. What is the gravity of this in the common pediatric office practice? That is the recent study. Now and then, if you search, you will get many studies like that. So around 30 to 50% of the OPD visits are because of respiratory problems. So that itself is sufficient to tell us what is the gravity of the respiratory problems in pediatric practice. If you see any pediatric OPD, 5 out of 10 visiting children will be with respiratory complaints. And again, not only OPD complaints, but the inpatient admissions is also, it is contributing up to 30%. So it is a huge share of ailments from respiratory system in pediatric medical management. So in Ayurveda, how we consider this? Very interestingly, whole respiratory system complaints, maximum, are covered by just 3 conditions. Those are Pratishaya, Kasa, Shwasa. In the photo, in the image, you can see that Pratishaya refers to mainly the complaints of upper respiratory tract, whereas Kasa refers to a transitional phase, which involves both upper respiratory and lower respiratory, that it will start from nasopharynx, pharynx, larynx, and the larger airways like trachea and the bronchi. Then coming to the breathlessness or the Shwasa, it is constituting the ailments of lower respiratory tract. So if we master Pratishaya, Kasa, and Shwasa, we can master the practice of 50% pediatric practice. So it is a very good topic of interest for all pediatricians. Then, interestingly, here in contemporary system, we don't classify with the physiological. Ayurveda gives always importance to physiological presentation rather than the structural abnormality. Whereas in the contemporary system, we will be calling it as rhinitis, pharyngitis, bronchitis, pneumonia, interstitial lung disease. So depending on the structures involved. So Ayurveda categorizes all these under the heading of functional derangement, that is Pratishaya, Kasa, and Shwasa. Interestingly, Charaka dealt with these symptoms in the opposite direction. So now we are dealing with the upper respiratory, then middle, that is transition, and then the lower respiratory. In Charaka Samhita, if you see, he starts with Hikka Shwasa, then Kasa Chikitsa, and later in the Trimarmiya Chikitsa, he is dealing with the Pratishaya. So he has come from the opposite direction. That may be the reason why he dealt with Shwasa first than the Kasa. So he started with Arsha, then started Udara, Arsha, then Grahani, Pandu, then Hikka. Hikka is a very typical juncture of transition from abdomen to the thorax. You see, the vagal innervations in the diaphragm and the stomach constitute vagal efferents for production of hiccups. Then he enters the respiratory system, that is Shwasa, then Kasa, and later he reaches Pratishaya. So straight away, the first condition, that is Pratishaya, how the child will be presenting. In classics, we have different classification of Pratishaya, mainly the 4 types, Vataja, Pittaja, Kaphaja, and Sannipasaja. Charaka further, engaging with the same condition, he goes on explaining Dushta Pratishaya and its complications, around 24 plus complications of Dushta Pratishaya, if these Vataja, Pittaja, Kaphaja Pratishayas are ill-treated or ill-managed or not attended properly. So it may lead to Dushta Pratishaya. Of course, in children, we are mainly concerned with Vataja, Pittaja, and Kaphaja Pratishaya. That's why I have highlighted those. And of course, if it is ill-managed, then they may land up in Dushta Pratishaya or Apinasalai condition. Now, Veti Gandhara Samsya Jantoho, he says. So these are all the typical complications which are experienced by ill management of Vataja, Pittaja and Kaphaja Pratishayas. So in today's topic, we will deal with only Vataja, Pittaja and Kaphaja Pratishaya. So once a child, you see, Pratishaya is, the cardinal feature of Pratishaya is the nasal discharge. So that will be the primary complaint. The child may be having other complaint, but nasal discharge is the first complaint. Then we categorize them under Pratishaya. If child is coming with fever as the main complaint, then associated with nasal discharge, then the child falls under the category of Jwara rather than the Pratishaya. So this is the primary thing what we have to consider before categorizing a patient in which disease the child falls. So by considering different presentations, if we have to consider Pratishaya as Vataja in nature, the presentation will be typically Jalabasrava. It is thin watery discharge associated with sneezing. Very, very important feature. If the child is associated with sneezing and thin watery discharge, then obviously child falls under the category of Vataja Pratishaya and you have to deal accordingly with the child. Then Swarabheda is also commonly associated with the Vataja Pratishaya. Then headache, okay, very difficult to judge in the children. If you say whether headache is there, then child will nod his head. If you say abdomen pain is there, child will nod his head. So it is very difficult to make out. So Jalabasrava, Kshavatu, Swarabheda are very clear. And if these cardinal features are there, straight away you can categorize the condition under Vataja Pratishaya. And especially in contemporary system, we can correlate this with the allergic presentations, allergic rhinitis conditions, and early viral infections. So interestingly, same disease, today it may be in the category of Vataja Pratishaya, and after 3 days, it may be in the condition of Kaphaja Pratishaya. So this is very, very important whenever Ayurvedic practice is concerned. So in the Avastha Vishesha, we have to treat accordingly. So we cannot label this as Vataja Pratishaya for next 15 days. No, it may not be. So these are all the things we have to consider. Pittaja Pratishaya. Rarely seen when in routine practice of Pratishaya as such. So if Pittaja Pratishaya Lakshanas are seen, it is more seen along with the Pittaja Jwara conditions. So Pitasrava will be there, and Nasadra Paka, very, very important cardinal feature what the Charaka Acharya says is Nasadra Pakaha. So you cannot directly call it as the ulceration in the nasal tip, but the erythematous condition, and okay, possibly if more pitta is involved, then ulceration may also be seen, and Jwara is associated. Here Jwara is not overtaking Pitasrava. If it is so, as I told earlier, child will fit in the Pittaja Jwara rather than the Pittaja Pratishaya. So especially the Coxsackie infections, we find multiple ulcerations in the perioral and perinasal region. So these will be categorized under Jwara rather than the Pratishaya. So of course, if at all in the later phase, if the child approaches you, if Jwara is not there, the child is with the Pratishaya Lakshana, yes, you have to categorize these under Pittaja Pratishaya. And of course, the transitional phase of bacterial and viral rhinitis also will be having transient Pittaja Lakshanas in the course. So initially Vataja and later it is Kaphaja, but in between there is 1 or 2 days of transition. There, if the child comes, you may get it as a Pittaja Pratishaya. Yes, of course, the fulminant rhinosinusitis like conditions, these should be categorized under Pittaja Pratishaya. Then very, very important is Kaphaja Pratishaya. We all know the secretion will be profuse, thick, and associated with cough. Very, very important cardinal feature is Pratishaya with cough, with thick secretions. Yes, the child may be landed up in Kaphaja Pratishaya, and your diagnosis will be more towards Kaphaja Pratishaya. Then Kandu, of course, Kandu is associated, and Aruchi. Aruchi, it is a cardinal feature in Kaphaja Pratishaya because the secretions are thick and it is blocking the nostril, and the child cannot experience the taste of the food. and the smell of the food. And in such condition, obviously there will be aruchi will be prevailing. So in contemporary correlation, we can consider advanced phase of viral rhinosinusitis, later phase of allergic rhinitis. Yes. Once the our immune system takes over the function, then all the acute manifestation will be resolved and there will be lot of casualties. It may be epithelial debris, it may be pathogen debris, or it may be our leukocyte and other immune cell debris. So these will be collected and thick secretion will be there, and so all these will be categorized under Kaphaja Pratishaya. So coming to the management. So here we will be moving fast through the slides and we will have enough time for discussion. That will be that will always be better in the instead of continuous one-way narration. If the discussion is more, then that will be more helpful for both of us. And the management of Pratishaya, though in classics, the description of Shodhana is given first. We may not go for Shodhana in all respiratory ailments. So our prime line will be Shamana, and if the things are occurring again and again, if the child is suffering from repeated infections, repeated problems, then of course the Shodhana is advisable. So I will deal with the Shamana first, then we can categorize for our convenience. So only for our convenience, we can categorize under the Shamana formulations under Churna, Kashaya, Vati, and Rasayana Aushadhis. So there are hundreds of formulations you can get if you search the text. That too, it may go even up to thousands if you start enlisting the formulations from all the texts. But always it is better to have handful of formulations used in wide range of ailments rather than choosing every new formulation over every day. So hardly, for example, in my practice, I have around 63 classical preparations in the OPD, and that is always sufficient for me to deal with all range of pediatric ailments. So that is always better. So as the government says, minimum government and maximum governance. So similarly, we can have a saying that minimum formulation and maximum treatment. So that will always be better. Churna. In Vataja Pratishaya, of course, the first line Churna is Sitopaladi Churna. Sitopaladi Churna. With honey you can give, because honey is the best anupana in children, but you can change the combination as and when required. Even you can prescribe it with ghee, especially in Vataja Pratishaya, and you can prescribe it with milk. So these have, whenever the condition is required, you can change the anupana. Then second line we say the Karpuradi Churna. It is less tastier and not easily accepted by children. So always separate Karpuradi Churna prescription is on lesser side in the pediatric practice. Then in Kashayas, yes, Amrita Rishta. Very, very important formulation. You can give it in wide range of ailments, respiratory ailments. Even in the GIT also you can give. And as I told, in Vataja Pratishaya, we consider early viral infections and all. In such conditions, Amrita Rishta does wonders, because it contains Amrita and equal quantity of Dashamula in it. So it takes care of Vatahara, along with that Kaphahara, because all the respiratory system is not void of Kapha. Whatever you say, it is Vataja Pratishaya, Pittaja Pratishaya, whatever, the involvement of Kapha is always there. And this helps in, and Dashamula is a very good Shotahara. So it helps in controlling the condition, and of course Dashamula Rishta can be the second line of medication. In the Vati, yes, Lakshmi Vilasa Rasa, yes, Rasa Aushadhis, you can judiciously, you can always use in children. There should not be any hesitation. And of course, you can enhance the usage of it as your experience grows. Initially start with gentle Rasaushadis, and then you can use as your experience goes with close monitoring. Short duration of Rasaushadis, yes, no hesitation. Always you can give 5 days, 7 days. All Rasaushadis you can practice, no problem. So Naradiya Lakshmi Vilasa Rasa is one of the best preparation in upper respiratory conditions, especially wherever there is Jalabasrava. Then Gorochanadivati is second line. Then Haridra Kanda Rasayana. Haridra Kanda, in all Pratishaya you can prescribe Haridra Kanda as the Rasayana, but not for 7 days or 15 days. You say it is not a medicine for the child, it is the food for the child. Instead of you put Horlicks Bornvita in the milk, you put Haridra Kanda. You say you are giving malt or you are giving a new drink to the child. So it will give benefit in long run. Yes, of course, Svedana, Bashpa Sveda will always be helpful, but very difficult to give for younger kids. In such condition, we can practice, we can identify a small room at house and let mother and child stay there doing some play activity, close the door and switch on the steamer. That will do sufficient Svedana to the child and inhalation to the child. So that is the best idea what you can advise for your patients. Then management of Pratishaya continuing, that is Pittaja Pratishaya. Here Churna, so Yashtimadu is the first, and you can have equal combination of Yashtimadu and Sitopaladi. That will work better in Pittaja Pratishaya. And coming to the Asavarishta or Kashaya, Draksharishta and Arvindasava. Here you can find more of Asavas, but there are frequent questions arise whether we can give Asava Arishta in children. Obviously you can give, but see that it is double diluted. The guideline says that children should not have, should not drink a drink which contains more than 5% of alcohol. So our all preparations contains around 8 to 12% of alcohol. But so if you make it double dilution, if you are giving 5 ml, 10 ml of water. If you are giving 1 ml, you add 2 ml of boiled and cooled water to that. And that is, and moreover, these are very well accepted by kids. We don't know the reason, but they accept it very well. So it is always safe, and you can give, you can successfully give Asavarishtas to children. Then Vati. In Vati, yes, Sutta Shekhar Rasa. Yes, in Pittaja Pratishaya and even in Vataja Pratishaya also you are giving. You can give. So we are not concerned with the Pittahara property of it, but we are concerned with the Datura Bija which is present in that, which is what you can call it as parasympathetic, and it reduces all the secretions. It may be the secretion from the oxyntic cells in the stomach, or it may be secretion from the nasal mucosa. So it is very helpful in reducing the secretions. So the nasal irritation and such things will be reduced by usage of Sutta Shekhara Rasa. Gorochanadivati, of course, you have found it in the previous slide also. And Haritaki Kanda is another important preparation. If child accepts it, it is the best medicine. So there will be astringent taste, but it is with a lot of Gouda, and child can take it easily. So it can be the Rasayana in routine practice for children. Especially if it does the anulomana of the things. So Vata anulomana is done, and the child will be benefited by the Rasayana. Then Kafaja Pratishaya. Yes, Karpuradi Churna is the first, and as I told, its taste is not so good. So you can add Talisadi Churna, but excess of honey should be used. So otherwise child will not accept the thing. You see, treatment compliance is very, very important. Medicine compliance is very, very important in pediatric practice. Even it is difficult to convince elders to drink kashayas. They come after 15 days, they say tablet is over and syrup is over, but kashaya is remaining. So that is the problem with always we will face in Ayurvedic practice. But once child is very much convinced, the child will take the medicines better than that. So in the Asavarishtas or Kashayas, you have so Dashamula Katutraya Kashaya is the first choice, but because of the taste, I have put it in the second line. And Pipalyasava is another option in Kafaja Pratishaya. Yes, it will have Kapha Vilayana. Why Dashamula Katutraya? It does the Kapha Vilayana. if we go through the Samprapti of Pratishaya, the Charaka says, Sthana doshai, Samsthana doshai, means the doshas get solidified in the Shiras and then it is causing Pratishaya. So, for the Vilayana of this solidified doshas, the Khatu Aushadis are very, very needed, and especially in Kafaja Pratishaya, the Khatutraya Kashaya, if given, it does wonders. Then in the tablet, Yoshadivati and Tribona Kirti Rasa. Yes. If you go to the preparation of Tribona Kirti Rasa, Bhavana is done with the Surasa Ardraka Hemavihi. Forget about all other contents. Just these three, combination of these three is really very, very helpful in relieving all the symptoms of respiratory tract. Haridra Khanda. Haridra Khanda is, as I told earlier, you can give. Steam inhalation, very difficult directly if you give, but as I told earlier, you can use that technique for easy administration of steam inhalation for kids. This is regarding Shamana in precise, in nutshell. And if we are seeing that child requires further treatment, whether child is having recurrent complaints, yes, then Natsya is the first choice. You have to convince the child, then it can be given easily. So in Alpa dosha, that is dosha is confined to Shiras. If you think like that, then Natsya is the best choice, and you can use only Nasya. Only local Shodhana is sufficient. So if you are anticipating Bahudosha, then of course the Virechana is the best line of management, and later you can follow Nasya. So these are all the modifications we have to do in case of Shodhana. So all Shodhanas you can administer to children. For all complaints, the best Shodhana is Virechana. So wherever possible, you try to administer Virechana, but see that it is required. If it is Shodhana is very much required, then Virechana is the best choice. You can make changes in the medication, but the Shodhana procedure will be Virechana. So complete Kaya Shodhana will be occurring and you will get the maximum result. Then, Upadrava, as I told, so if it is ill managed, always there is a chance of child landing in Dushta Pratishaya like condition. And once you go with the explanation of Dushta Pratishaya, you will get all the associated complaints in that. It may be nasal polyps, it can be adenoids, it can be hypertrophic turbinates. Everything is clustered in these explanations of Dushta Pinasa, Pinasa and all. So in such conditions, again, Tridosha treatment is told. So whatever we have discussed, apt application of all those treatments, especially the Nasya and application of Kshara. Application of Kshara is very much useful in such conditions. Kshara Jala or Tankana Jala. Now also, 2 days back, one patient has got admitted with the complaint of nasal blockage, sleep apneas, and very typical of adenoid. So we are instilling a saturated solution of Tankana Kshara as Nasya. We can categorize it under Avapitaka Nasya or somewhere else. So it is a Tikshna Nasya given in order to reduce the size of turbinates and adenoids. So within 2 days, child has started getting the improvement, that is, child can sleep without disturbances, sleep apneas are minimized, and so Kshara Jala is very good. You may not directly, you may not get the reference, but the usage of Kshara is told, especially in case of Apinasa and all. So you can use Kshara Jala, and later in the afternoon you can have Anutaila Nasya. So both the combination of these two will help the child in relieving the symptom early. So at the end of Pratishaya, so we will have one case scenario. So anybody of you will be saying which dosha is more likely to dominate in this case. So a male child of 7 years old with history of fever 1 week back, complaints of a thick yellowish nasal discharge, associated with nasal blockage, lack of taste and smell. Anybody? Which dosha is dominating? Yes, many answers are there. Yes, kapha, kapha pitta. Yes, very good. So for just for confusing, I added the jwara and all history of fever. So, but it is kaphaja pratishaya. Because 7 days back, as I told, so there may be changes occurring in the doshic presentation as the phase of the disease changes. So that is always will always be there, and here it is kaphaja pratisha. So the yellowish discharge, okay, don't worry. So yellowish nasal discharge does not always indicate pittaja. But many of the participants rightly pointed out it is kaphaja, and okay, some pitta association we cannot rule out, yes, but it is dominated, it is kaphaja pratisha. So very good, and we will move on. Then coming to kasa. Here vataja, pittaja and kaphaja kasa are commonly seen. Again, ksataja, kshayaja, we will not, it is out of scope of this presentation. We will not deal with that now. So if we master vataja, pittaja and kaphaja kasa, that is sufficient for the routine practice. Yes, in vataja kasa, the presentation will be, of course, we all know that will be dry cough. Very, very important feature is Hrit Parshvashula. Dry cough will be always be with more exertion. So if we conduct Vamana to the child and there is nothing inside the stomach, then after one Vamana bout, there will not be anything in the stomach. Then Vamana Vega will be very, very painful. So similarly, so when there is no expectoration and child is coughing again and again, it is very painful, and with Parshvashula is associated, and child may faint sometimes. And the Swarabheda is associated. Again, Nirghosha Bahulam. Yes, child is coughing like barking. Nirghosha Bahulam. The cough can be heard in the neighboring OPD. Yes, it is more likely to be Vataja Kasa. Commonly, we see such condition in the case of pharyngitis or laryngobronchitis and chronic tonsillitis like conditions. We get these cough. Then Pittaja Kasa, cough is there, but with the Pita Nishtiva. Yes, fine. Then Tiktasyata, Swarabhedaha. See, Swarabheda is here also. Thirst and burning sensation. So, correlating to the condition, we have to be highly suspicious of GERD when child is presenting with these symptoms. Especially the complaint will be more during lying down position, and night cough will be there, and recurrent the Tiktasyata. It is difficult to elicit in child. Okay, of course, after 5 years and all, child can be can say, but GERD is observed even earlier. In the toddler age group, we see many a times. So in such condition, the pitta management at the GIT level is also very, very important and crucial in subsidence of such type of pittaja variety of kasa. Then, of course, the other conditions like acute fulminant pharyngitis, acute fulminant tonsillitis means acute tonsillitis with all the redness in the throat and all, it will be associated with burning sensation. So it is categorized under pittaja kasa. Then kaphaja kasa. Bahula kapha, profuse expectoration. So one cough is, while coughing itself, you can feel the amount of expectoration in the throat. So that is kaphaja kasa. Then vomiting, utkleshaha, chardihi. These are all the wordings used for demonstrating kaphaja kasa. Then fullness of chest, vakshapurnata, heaviness in the chest because of excessive secretion, and there will be blockage of the airways because of the thick secretions. Then sadanaha, of course, when such things are there, the child will be showing a sick look. So it is very commonly seen in conditions like infective bronchitis, bronchopneumonia. Yes, the very small line between Kaphajakasa and Tamakashvasa. The severe form of Kaphajakasa may mimic the Tamakashvasa. So, this in case of bronchopneumonia, many times these will be associated with fever. So, both management we have to consider in terms of management. Then later phase of acute tonsillitis and acute pharyngitis and sinusitis. Yes, sinusitis. So there will be continuous supply of mucus from the frontal sinuses and maxillary sinuses, especially in kids more than 8 years. We can see such type of presentation. How much ever they cough, the sputum is not at all empty. So this is a very typical presentation of Kaphajakasa. Then coming to the management, first Shamana, as I mentioned, in Vatajakasa, Sitopaladi Churna, it's LSM, Lagu Sutta Mishrana. So it contains the combination of Talisadi, but of course the other ingredients are important. Those are Yashtimadu and Gairika. So these are all acting as a Vata Pittahara, and it is useful in Vatajakasa. Then Draksharishta, Pipalyasava, these are all the medications what can be given as Dashamula Rishta. So Vatahara and Shotahara. So it acts very good in case of even in Kaphajakasa. Then Yashtimadu and Karpura. Here we have few formulation in the market. I have not purposefully not mentioned the name of proprietary medicines. So Yashti and Karpura, the tablets involving these will be very, very useful in as it acts as a demulcent at the throat area. Then Mrityunjaya Rasa is very useful, as I told, in case of infective kasas. Mrityunjaya Rasa is very, very helpful. Then Rasayanas in all kasas, yes, you can follow these Rasayanas. Agatsya Haritaki, Chavanaprasha, Haridra Kanda, and lot of variant of Chavanaprasha you get in the market. So they every new company adds one more ingredient and gives another name to the Chavanaprasha. So you can use any of those as a Rasayana. Then okay, Svedana, Kavala Gandusha, okay, it will be helpful in Vatajakasa. Pittajakasa, Sitopaladi and Yashtimatu, as we had discussed in case of Pitta Pratishaya. Then LSM, that is Lagu Sutta Mishrana, as it contains Gairika and Yashtimatu. Then Kashaya, Rasavarishta, Vasakarishta, Aravindasava, Draksharishta. These are all the Pittahara and Anulomaka can be used whenever GERD is suspected. So like Haritaki Kanda, and all other medications. Again, if you are you can use even Sutta Shekara Rasa for a very short duration, 3 to 5 days. Then various vatis, like especially Kadiradi vati and Yashtimadu containing, any vati containing Yashtimadu as a primary ingredient can be used. In the Rasayana, as Kushmanda Rasayana stands first. So very well accepted by children. So Kushmanda Rasayana. It is very tasty and it can be used as a Rasayana in children with the Pittajakasa. In Kaphajakasa, so Talisadi Churna stands first, then the Karpuradi Churna. Then in Kashaya or Asavaristas, as I told, Dashamula Katitrai, very, very important. And you get very good result. As I told, just the taste is one disadvantage in that. Then Vidangarishta and Kadirarishta. These are helpful in reducing kapha at the level of throat. So Vidanga, you know, it is Pramati, and it helps in clearing the channels. It may be sinus, or it may be the eustachian tube or whatever. Then Lavangadivati, yes, with the honey you have to give. It is very Tikshna and Ushna in nature, and you have to increase the quantity of honey whenever you give it. Then Tribona Kirti Rasa, of course, as I told earlier. Then Chavanaprasha, Kantakari Leha is another new introduction here in Kaphajakasa. So it will be helpful in doing Kapha Cheda. Svedana, you see, Svedana, whenever I say Svedana, so it can be given internally in the form of gargles, or it can be given externally over both the sides of throat. neck. If it administered, just you can just dip cloth in warm water and give Svedana. So it will be very much helpful in relieving the symptoms. Management of Shodana. In Vatajakasa, that is Snigdha Virechana. In Pittaja also Virechana is indicated, but whenever you suspect more involvement of Kapha, Vamana is indicated in the text. And if you are practicing Virechana, that is helpful in all the conditions. So if it is Kaphajakasa with more of Kapha, then yes, Sadhya Vamana or one full course of Vamana also you can plan, but it should be followed by Virechana. As I told earlier, Virechana is the best Shodhana, whatever, for the long term. Then, yes, at the end of Kasa, we will again sum up with a small case scenario. A female child of 4 years complains of continuous cough with a little expectoration since 2 days. Gets exhausted after episodes of coughing and complains of chest pain. It's very clear. And she had a history of sneezing and throat irritation 5 days back after consuming ice cream. Now, what is the dosha involved? That is which type of Kasa it is. Yes, it is very clear. Very clear. So there is no doubt it is Vataja Kasa. And 5 days back, you see, child had Vataja Pratishaya. Vataja Pratishaya child had, and the frequent problem is, okay, mother knows child is having Pratishaya or running nose. Then again, before coming to you, just 1 day prior, child has been administered with bhaji or anything like that, pakoda or like that. So people don't know when to give. So Patya does not mean that the child should be totally abstained from the fried items. Child should be abstained from the ice cream. No, you can give, but correct time, correct weather, and correct condition of your child should be monitored whenever you are giving such viruddhaharas to child. It can be given, but within a controlled manner. So that should be taught to parents whenever we say Patya and Apatya to them. Then very important condition is, we will move further. So Shwasa. You have different varieties of Shwasa, but Tamaka Shwasa is one such condition which is widely seen. All others, as I told earlier, Ayurveda believes or thrusts, or because of various reasons, we don't know, because the access to internal organs were not so easy like now in those days. So he has categorized many other system disorders also in Shwasa. So it may be the cardiac diseases, it may be GI diseases, or it may be neurological conditions. So many things are included in the category of Shwasa. So Tamaka Shwasa is more seen in children, and we will discuss Tamaka Shwasa in this presentation. So what will be the presentation of a child with Tamaka Shwasa? Whenever child comes to you with the Shwasa, it is breathing difficulty. So child will be associated with, it will be associated with the constellation of symptomatology. So those may be breathlessness or Shwasa, Gurguraka or Pujana. So orthopnea is Asino Labate Saukyam Shayanasya Samirana. So all these things. So it is not the word of any modern textbook. So it is the wordings from the Samprapti of Tamaka Shwasa of Charaka Samhita. Then nighttime exacerbations, paroxysmal nocturnal dyspnea. Then not able to speak a sentence. Pritrat Shaknoti Bhashito. So these are all the typical words which are typical words which are used, and these are the cardinal features in Tamaka Shwasa. In sympathetic stimulation, there will be hypoxia, of course, there will be sweating. Many other sympathetic symptoms are mentioned in that these categories. Whenever these are seen, so it should be understood as an acute phase of Tamaka Shwasa. Correlation is very clear. It is childhood bronchial asthma. Then Shwasa Samprapti, of course, here one thing I want to stress is the Pratiloma Gati of Vata. Pratilom yada vayu srotamsi pratipadyate. So it starts with that. So the Pratiloma. So whatever medicine we are giving, our aim should be Anuloma. So that helps in the Samprapti Vigatana. That's why I showed this slide. Then otherwise, Kavaigunya. What is Kavaigunya means? It is the genetic susceptibility of the person towards allergic manifestation of asthma. So if mother had allergic rhinitis, father had allergic rhinitis, this child is highly susceptible for bronchial asthma. So such type of and Nidana, of course, it may be Viprakrishta or Vyanjaka Nidanas. Vyanjaka Nidana in the sense Vyanjaka Prerakaha. So immediate measure of immediate reason. So for example, child, especially this weather, Megambushita Pragvataihi Shleshmalaischa Abhivardate. Megambushita Pragvataihi Shleshmalaischa Abhivardate. So it is Vyanjaka Nidana. So whenever there is rainy season, clouds, cold weather, so of course it will be increasing. Then how we have to approach the Tamaka Shwasa? Mainly two varieties we have to consider. So it can be either Kapha-adhika or it can be Vata-adhika. So you can see the pathophysiology occurring in Tamaka Shwasa, bronchospasm and the inflammation and edema and the exudate in the airways. So exudate contributes towards Kapha and spasm is because of Vata. So these are the two varieties where exudate is dominating. Then you categorize that under Vata, Kapha-adhika variety of Tamaka Shwasa. If spasm is more, you categorize it under Vata-adhika Tamaka Shwasa. So coming to the features, in case of Kapha-adhika Tamaka Shwasa, you will be getting Shwasa, of course, in both the conditions, child will be experiencing breathlessness. Then Gurguraka is more seen in Kapha-adhika Tamaka Shwasa, the crepitations. Either you can find it in auscultation or just palpation over the chest itself will give you idea regarding the collected secretions in the airways. Then again, in case of Vata-adhika, it will be bronchi will be dominating. If you keep your step, you can hear polyphonic bronchi through the lung field you will get. Then Kasa is very, very typical in case of Kapha-adhika Tamaka Shwasa. That's why he says Kasine Chardanam Dadyat. So Kasa is because of the obstructed secretions in the airways, the body wants to expel it out. Then Utklesha and Chardi. Of course, when these secretions are beaten up by the ciliated columnar epithelium of the airways. So when it reaches the throat, the gag reflex is stimulated and child wants to vomit it out. And one more thing, child is not able to spit it out. So continuously it swallows. Once the quantity of kapha increases, the expectoration increases in the stomach, child will have an vomiting reflex and child will empty the stomach. So these are the presentations of Kapha-adhika Tamaka Shwasa and Vata-adhika Tamaka Shwasa. In Vata-adhika, yes, the fainting will be seen because of the severe spasm of the airways. So Charaka says, Hikka Shwasamayi Heko Balavan Durbalo Aparaha, Kapha-adhika Stataiko Ruksho Bhukvanilo Aparaha. So it is a very typical classification Charaka has guided us to make in case of Tamaka Shwasa. So how to manage these conditions? First and foremost, we have to manage the acute episode, that is Abhyanga with Lavana Taila irrespective of the condition, whether it is Kaphadika, whether it is Vatadika, you go for Lavana Taila Abhyanga. But we commonly practice in our OPD is the same thing. We admit the child, we give Abhyanga with the Brihasaindavadi Taila and give Nadi Sweda, especially with the Tambula Patra and Halin drop what we get in the market. So that will give you the more Kapha Vilayana action. So once these are done, yes, meanwhile you can nebulize with the Tambula Arka or Barangi Arka, which are very, very helpful in liquefaction of the obstructed kapha, and it promotes mucokinesis, liquefaction of mucus, and its throwing outside the airway by the ciliated columnar epithelium. So the mucokinesis is promoted. Then of course we have to see the SpO2. If it is less than 92, child may require oxygen and we should take care of it. Then Hikka Shwasarditam Stigdairado Svedairupacharet Aktam Lavana Tailena Nadi Prastara Sankara is the principle of management explained here. Then after that, continuing, Charakacharya says, so if kapha is dominating after Vilayana, if you find that kapha is high, then go for Sadhyo, go for Vamana, he says. There, the apt Vamana is the Sadhyo Vamana, what we can practice rather than the Snehapana. It is very difficult to do Snehapana in that stage. So if Vatadika, yes, straight away go for Snehapana. Within 2 days of Snehapana, child will be relieved from all the bronchi. So very commonly we experience in case of Vataja Tamakashvasa. Initially breathlessness will be there. On auscultation, there will be polyphonic bronchi, but there are no wet sounds. So it is very, very important indication for immediate management with the Lavana Taila Abhyanga and Nadi Sweda. Then straight away go for Snehapana. And within 2 days of Snehapana, especially with the Indukanta Grita or whatever Grita you may prefer, in case of Kantakari Grita, in such conditions. So child will come out of the bronchi just by within 2 to 3 days of Snehapana. Of course, continue it and then go for Virechana. So in case of Kapha Pradhana, as we administer Sadhyo Vamana, then after 1 week of gap, then again start Snehapana and give 1 course of Virechana. So this is the complete course of Shodhana for Tamakashvasa children. Then Shamana management. In case of Kaphadika, Dashamula Katatraya Kashaya and Kanakasura, we frequently give the combination of these two. So one does the Kapha Vilayana and another does the bronchodilation. So both these will help the child with the Tamakashvasa. Then Karpuradi Churna is the first preference. And as I told earlier, we give it along with the Sitopaladi Churna because of its taste. And of course, Sitopaladi Churna is also not bad in case of Tamakashvasa. We can give. Then very, very important medication is the Shwasakutara Rasa. Short-term usage of Shwasakutara Rasa along with the Tambula as Anupana is very, very important. And Tambula as Anupana, it is helpful in bronchodilation. And along with that, it is helpful in mitigating or reducing the ill effects of Shwasakutara Rasa if at all present. So then the Tribona Kirti Rasa, as I told earlier, Surasardraka Hemabhihi is the ingredient in that. It is Tulsi, Ardraka and Datura Patra. So it is very easily or very happily used in Kapha Pradhana Tamakashvasa. And Rasayanas, Agri Haritaki and Agatya Haritaki are the common Rasayanas used. And Haridra Khanda, as I told earlier, in all respiratory ailments, it has to be given not as a medicine but as a food. Then, in case of Vatadika, Pushkaramula, the preparations of Pushkaramula along with Kanakasva is very beneficial in Vata Pradhana Tamakashvasa. And Churna, of course, the same, Karpuradi and Sitopaladi. Again, the tablet, that is Vati, Shwasakutara Rasa along with Tambula. Then the Rasayana. Then the overall Rasayana for respiratory system, use Swarnavasma and Abrakavasma, irrespective of the condition, in various forms. You may be getting it in, as I told earlier, in some of the Chavanaprashas, they have added Swarna Bhasma, Rajata Bhasma, and many other potentiating medicines, and you can use that, or Abraka Bhasma separately, you can mix it with the Sitopaladi Churna and you can administer as a Rasayana, and Chavanaprasha you can administer. So these are all the preparation can be used. There are many other Rasayanas. So mainly these preparations can be used as Rasayana. Patya, very, very important. Yes, this is our failure if we don't consider Patya Sevana in respiratory system. Yatkinchit Kafavatagnam Ushnam Vatanulomanam Veshajam Panamannam Vatadhitam Swasa Ipine. So these are the Patyas should be followed. Very commonly used apatyas in children are biscuits, chocolates. Whether child consumes outside food, no. Parent will be saying no. Then if you ask biscuits, no, biscuits he takes. So which biscuit? So it may be either Chastamaska or 50-50. Or it may be Good Day or Dark Fantasy. So these are all the things which acts as Viruddha, especially your medicines will not act if child is continuing with such type of apatyas. Then third at night, fried foods, yes, of course, roti and chapati. As I told, Ushnam Vatanulomanam. Anulomana is hindered by consumption of these Vidahi Aharas, which are heavy for digestion and takes longer time for digestion. These should be avoided. So Sadyomana is the process of Sadyomana. I just showed you to just to show the tender kids who are administered Vamana. This child is of 3 years and this girl is of 4 years, and she is of 6 or 7 years. So we frequently conduct Vamanas, especially in this season because of COVID. Now it is less. Otherwise, frequently every day we conduct Vamana, 2 to 3 Vamana for Samakashwasa patients. You get wonderful result. You see the indication. You see hyperventilation and secretions collected in the larger airways. And this is after Vamana. After Vamana, after 2 days of Vamana. You can see it has reduced, and see the decrease in the hyperventilation. See the decrease here and here. You see the hyperventilation is reduced. So these are the wonderful benefits of Sadhya Vamana what we get, and we have to practice it with the confidence and with the experience, and don't initially rush to the such type of practices, but gather experience, and later gradually you increase the frequency of practice of such wonderful therapies. And I thank you on behalf of the whole of our department. This is our team of Kaumara Vritya, headed by Dr. Shailaja Madam, and then Vijayalakshmi Madam, and myself, Dr. Arun Raj, and Dr. Kannan Sagar. We thank you. And once again, I thank everybody for the organizers and whole team of Bala Prana Raksha 2021 for giving me the opportunity. And I'm very happy to discuss if any questions are there. Thank you, sir.
Okay. Thank you, sir, Dr. Naveen Kumar, sir, for your brief and elaborate explanation related to the clinical oriented and how to manage in the clinical practitioners in Ayurvedic pediatricians can manage the different condition at this situation related to the Kasa Shwasa and Pratishaya management. Thank you, sir. Thank you for your valuable time spent with this, and also you are a part of this seminar, and hope I think all the participants get the very good benefits from this seminar. And now the seminar, now the time for the discussions. With any questions related to the topic, please participants send your questions in the chat box, and we'll be discuss it now. Shukmar sir.
Sir.
Madam.
Thank you so much, sir. Dr. Nayan Kumar, sir. Now the session is open for the discussion. We are having eminent personalities in the Kaumara Vritya across the India. It's open for the discussion. Please tell any opinions about today's session. We are requesting Dr. Reena Kulkarni, madam, well, some opinion about today's session.
Reena, madam. Okay, we'll ask the questions.
You may have to unmute. You may have to unmute her because participant cannot unmute. No?
Sir, I will, sir. I will now, sir.
Hello.
Sir, 1 second, sir. 1 second, sir. Yes, madam. Audible, madam?
Yes.
Yes, please.
Good morning, everyone.
Good morning, madam.
Good morning, Nayan sir. Good morning.
Nice to see you in this platform.
Same here, sir.
Madam was my senior colleague at Hassan here, and again mentor too.
In fact, we were good friends. Rather than colleague and senior, we were good friends. First of all, I would like to thank Dr. Chandrasekhar and team for giving me this opportunity. And I would like to congratulate the whole of the team for organizing such a nice webinar. And yesterday talk also, it was wonderful. And today's, of course, very nicely explained. Dr. Nayan Kumar has included all the clinical perspectives and its Avastika Chikitsa, how to, in short, clinically, how to analyze based on the doshas, and accordingly, how to select the medications, how simple could be the treatment with the best results. So I think sir has included whole of your 10 years experience in his talk, and he needs a big applause for that. Congratulations, sir.
Thank you, madam.
And through the years, to share few my clinical experiences, through the years, we see that for respiratory treatment, ailments of children, to treat respiratory ailments in children, Ayurveda is best. Right from the infancy, we can include many of the Ayurveda principles. It may be in the form of simple talam, or it may be in the form of simple drops. You need not be a doctor to include all this. We know that whenever a small baby gets a cold, mother knows that she can give 2-3 tulsi drops with honey, and that will be cured. Similarly, she also knows that to put little bit of ginger in baby's sari, which they prepare, that will relieve the congestion of the child. Similarly, when they come in the infancy to the OPD for like vaccination clinic or something, they always come with the complaints that this baby has always a noisy breathing. It keeps its mouth open. There is always sound. These complaints are very common in the clinical practice. And we know that we keep on advising them, just apply Rasna Churna after giving bath to the child's head, or apply little bit of Nilgiri oil, or apply this Pranadhara to the chest of the baby, or put the Helen drops in the warm water and just give us local fermentation. So these are all small tips which relieve the clinical complaints in these small infants. So similarly, sir was telling about the Rasayana aspect. Of course, Abrakavasma and Swarnavasma, the best choice for treating respiratory ailments. And similarly, in chronic or recurrent Tamakashwasa conditions, see, we do have this Malasindura, Samirapanaga Rasas. So they are excellent in relieving the acute inflammation of the respiratory system. And we may give only 3 or 4 doses. That is good enough to relieve the acute inflammation. And that is followed by our regular prescriptions would be, they go long in management of this respiratory complaints. Similarly, sir has also done guided one postgraduate thesis like Pippali. Pippali has been wonderful rasayana for respiratory complaints, especially for kafaja kasa or vata kafaja tamukashwasa or kapha pradhana tamukashwasa conditions. Vardhamana Pippali rasayana also we can this one. If not possible to practice Vardhamana Pippali, just a simple Pippali churna, maybe 500 mg to 250 mg to 500 mg, 2 pinch of Pippali churna every day early morning with a glass of milk. It tastes good, it doesn't alter the taste much. And if it is practiced regularly, we know that Pippali is a very good immunomodulatory drug and it is respiratory specific rasayana again. So this study has been done already in Hassan, and in fact we also did Vardhamanam, this one. Chatushashti Pippali is again one of this. So we had done one of the RGUHS sponsored project on Chatushashti Pippali. Wonderful results with these things. So simple things, but good. Normally, as sir was telling, what is the reason for recurrent respiratory complaints in children? Is because of this childhood age, because of their food habits, Agni is not proper. So maintenance of Agni is also one of the thing in preventing and treating the respiratory conditions. So Pippali is one which is good Agni correction, Pachana, as well as respiratory specific rasayana. So I think there are many more handful of drugs that can be explored in the future and coming discussions. Anyway, I enjoyed too very much in today's class. And once again, thank Dr. Nayan sir for such a wonderful presentation and the whole team.
Thank you, madam. Thank you.
Hello.
Sir.
Hello.
Sir.
Hello. Thank you, Dr. Reena madam, for your opinion regarding the today's session. There will be time for discussion. Some questions is there. Hello.
Hello.
Yes, sir. You are audible, sir. Madam
okay,
is muted, sir.
Okay.
Yes.
Hello. Nayan sir.
Sir.
Please explain procedure of Sadhya Vamana.
Okay. Okay. 1 minute. Let me. Okay. Can I share the screen now?
Okay.
Yes, sir. You can share, sir. You can share.
So otherwise, I'll tell, and it can be given afterwards. Anyhow, we will be given.
Okay, sir.
Yes, sir.
Okay.
Yes, sir. Yes, sir. Yes, sir.
That will be. So initially, we give kapha utklesha. One thing, if the kapha is so profuse, so increased, and you can advise Sadhya Vamana immediately. No need of kapha utklesha itself. Or else you have to give kapha utklesha kara ahar. So what we usually give is at the time of visiting OPD, patient will be in distress. So in such condition, we apply Lavana Taila and give Nadi Sweda and thus Kapha Vilayana. Then at the night, again we give Kapha Utkleshakara Ahara, like curd with sugar or Masha Payasa or such type of Kapha Utkleshakara Ahara. And then next day, early morning in the Kapha Kala, we give Vamana. So that is best practiced and better results we get with such type of practice. So in Sadhya Vamana, initially, as the preparation in that I showed, so we give payasa-like preparation made Yavagu is told in classics, but we make it sweeter and make payasa. And we administer initially little 1 cup of that, and then we start administering kshira or yashtimadu or sugarcane juice, whichever is suitable to the child. and we start Vamana with such type of preparations, and we give 1 glass. Then we give Vamana Ushadi. That is preparation of Yashti Madhu and Pippali, Madhu and Madanaphala. Madanaphala, hardly we give 1 to 2 grams and maximum 3 grams, depending on the age of the child and the capacity of the child. Then we give double that of Yashti Madhu Churna. For example, you can write down as 3 grams of Madanaphala Churna, 3 grams of Pippali, 6 grams of Yashti Madhu Churna, and quantity sufficient of Madhu for mixing it and administer to the child. So then after giving that, we keep on administering Kshira or Yashti Madhu Fanta or sugarcane juice, and again, so that child will get vomiting half because of Madanaphala and half because of the stretch reflex. We are not totally relying on the Madanaphala to act, and if we keep it as such for longer duration, it causes abdominal discomfort. So as we are practicing it in children, so we are administering, we are not waiting for one muhurta like that, and we are continuously administering milk, for example, and then after taking 3 glass, 4 glass, child vomits out. Then again we give next dose, that is next milk. Medicine is given only once. Then again we give milk. First glass he takes very easily, second glass with little difficulty, third glass child does not take at all. We have to convince him because the already abdomen has developed, stretched that much, and but once you administer that glass of milk, the child will vomit again. So this practice is done for 3 to 4 times, and then the child is given one vomiting with the Saindava Jala, and then after that Dhumapana is given with the Haridra Dhuma, and then child is advised to take rest. Whenever child gets appetite, Ganji is given, and after that some Sarjana Krama is followed. Such a way this is done. And very importantly, if you auscultate chest before and after Vamana, really you will get the confidence in your procedure. So it is very effective procedure. Sadhya Vamana, you have to practice, but one caution is child will be saying yes to all when you admit, but once you give the medicine, child will start crying and child will run away. It is very tedious procedure to convince if the child is not accepting. So in such cases, in such adversity, you just give some Manulomana Aushadhi and just observe the child for passage of 3 to 5 loose stools, and just keep the child in observation for 1 day, and then you can discharge the child if at all you cannot practice Sadhya Vamana in that child. So such things are also we are experiencing, but now as the experience goes, we are managing it well. But if the initially means, it will be the problem that we should be ready to face in such conditions.
Hello, sir. Thank you, sir.
Thank you,
sir.
sir.
Another question.
Sir, one direct question is there, sir, from Abhilash. Patient is on steroid regularly. Can we introduce this Nayafana directly?
Yes. You cannot reduce the steroid immediately. And again, a steroid you can give at night anyhow. And once the Virechana is there, you can reduce the dose. After Virechana, you reduce the dose. But while administering, you can. You see the condition of the child. If you see, okay, with the steroid can withhold for a few days. If the child is okay, there will be convalescence effect of the steroid, continued effect of the steroid. There will not be any sudden exacerbation immediately. So if it is the case, you reduce. But if child really requires steroid at that time, then give it in the evening rather than at the time of Snehapana. So that can be done. But there is no, again, steroid hinders with the secretions, GI secretions. That's that. There will be some interference with the normal effect of Virechana, complete effect. We may get 80% of the effect rather than 100%, but it is not at all contraindicated. You can continue, you can practice, and as your experience mounts up, you can reduce or stop the steroid whenever it is possible.
So next question is, in children, running nose was and is a commonest symptom. Please guide a treatment protocol in a such condition, sir.
Yes, running nose, you categorize it whether it is Vataja, Pittaja or Kaphaja and deal it accordingly. So as we have discussed.
Okay, sir. Next question is, how to decide associated doses in kids?
It is again a tough challenge, and you start with minimal dose. Minimal dose, for example, nowadays the various companies resolutions come at various doses, various dosage for means various strengths. Someone will be very little, hardly it may be around 100 mg, or some may be up to 250 mg or 500 mgs. So depending on that, you just start with the 50 mg or so. After 1 year, you can easily practice, and even we are practicing after 6 months of age. So you start with the 50 mg or minimum dose, minimum effective dose, what you feel. There is no classical guideline as such. For example, Tribona Kirti Rasa. For example, in my practice, I can say that Tribona Kirti Rasa of 125 mg, I am giving half BD after 9 months for a duration of 5 to 7 days. So this can be easily practiced, and after 3 years, you can make it up to 1 BD also, 125 mg. When you are giving it for short duration. But long duration means keep the dose little lesser. So this is the general guideline what we can say. And one more thing I want to advise, not only in Rasa Aushadhi, all the medicines you have to take yourself. You have to taste yourself. Then you will come to know what is the effect of it, what is the potency of it. And so hardly any medicine you can take for a few days, nothing wrong in that, and it will not cause any problem. So you have to, whatever you are prescribing to your patient, you should taste it, you should experience the effect of it, and then only you practice it. Then your confidence level will be of very, very high. So that's why every medicine you practice first on yourself, and then you try.
Where is the reference of
you have to introduce it to the patient. Because various companies produce various types of same medicine. So that's why you will be confused otherwise.
Sir. Okay, sir. Thank you, sir. Another one question, sir. A child of 9 years old complaining of continuous sneezing, approximately 40 to 50 episodes per day, and no any associated symptoms. What might be the diagnosis and management?
Yes, it is continuous sneezing and nasal discharge. Of course, it is Vataja in nature. Child may have come across a severe allergy, and child may be continue to expose to that allergen. So that may be the cause. And now, if there are secretions and irritating and nasal irritation or throat irritation, first you give the medicine to reduce the secretion. For example, Goro Chanadivati of a good company, you can give half BD to 1 BD. So it will come down the secretion and nasal irritation will be reduced. And the child can be advised with the Yashtimadu Churna for frequent licking again and again, which will act as oropharyngeal demulcent, and child's vagal irritation will be reduced. So this sneeze reflex will be minimized, and the child will get comfort. And along with that, steam inhalation is very, very important to stimulate the epithelia to wash out the adherent allergens in the epithelia regularly. So these will help in reducing the complaint. And Haridra Kanda, as I told earlier, can be started immediately, but for a longer duration.
Okay, sir. Thank you, sir. Next question is, the question asked by Nagaraj is, sir, what are the precautions can be taken to prevent from COVID of pediatrics in present situation? Any medication or any measure should be followed? These questions is coming since last session also, sir.
Yes, sir. So improving immunity is the first thing. So we advise preparation containing Swarna Basma. for taking in a lower dose for an interval of minimum of 1 to 3 months, then keep a gap of 1 to 1.5 months, and again continue. So this intermittent administration of preparations of Swarna Bhasma is very, very effective. There was question, we were giving Kumara Bharana Rasa here. So it contains Swarna Bhasma, Rajata Bhasma, and many other preparations. But how long to be given? First wave is over. While we started, thought of stopping that. Again, second wave arrived. So my humble suggestion is you give it intermittently. So that will be very, for my kid only, I had given Kumara Bharana Rasa continuously for last 1 year. And because we will be having frequent exposure. So, but he is fine, and we are also taking, we are fine. So we can't claim that it is because of Kumara Bharana Rasa, but obviously it will have its effect on that. And again, other immune enhancing preparations like Chawanaprasha in a lower dose of 1/4 teaspoon. It hardly comes around 2 to 3 grams. BD you can give for toddler age group also. So for elder kids, increase the dose. So this is another. Then Haridra Kanda, as I mentioned. So it is a health drink. You can give it, not as a medicine. So these are all the things to prevent. And yes, if child has exposure in the home, potent antiviral, right? Bunimbadi Khada. Bunimbadi Khada, liquefy it, dilute it, add 1 more teaspoon of honey, child drinks it very well. So give it continuously till the exposure is on. Because many times in the second wave, really around 20 families of my patients itself got COVID, and each home 2 kids were there. So they have, few of them have suffered from COVID also, but no complications were there. So when exposure is on, you add such type of preparations. Amruta Rishta is very good antiviral, immunomodulator, and also GIT modulator. So special symptomatology experienced in kids this time in the second wave is the loose motion. Fever was there. Rather than the respiratory, GIT symptom is dominating. Abdominal pain and loose stools for 2 to 3 days. So there you give Balachaturvadra. Balachaturvadra, few companies prepare good quality of Balachaturvadra preparation either in the form of powder or syrup. So you administer it, Gana, Krishna, Aruna, Shringi. What else is required to protect our GIT and respiratory system from that? So these are all the gem of the Ayurvedic Rasayanas, what we can practice safely in children during this COVID pandemic.
Next question is, sir, patient age of 9 years, female, complaining of recurrent cold, whole year since 2 years, mild cough and no cold exposures, loss of appetite, child travel for newly junky food items, took allopathy medications but not corrected. What must be the condition and treatment?
Sorry, sir. Can you repeat it, please? I missed the link actually.
So patient age of 9 years, female, complaining of recurrent cold whole year since 2 years, mild cough on cold exposure, loss of appetite, took allopathic medications but not corrected. What must be the condition and treatment?
Yes. So that
child always travel for the junky items.
Okay, that is always there. And along with that, you ask parental history, whether parents are having allergic rhinitis or asthmatic or allergic skin manifestations. If that is there, yes, you just tell the parents that you have to give me some time. You buy some time from the parents. And then treat the existing cold first, as we have discussed. And then give a course of Virechana, advise strict diet, that will resolve the condition. This is very typical of allergic manifestation, but with the triggers, Prajnaparada triggers from both the child and the parents. So these things, that means the Viruddha Aharas, you just take a pen and paper and write down do's and don'ts and take them, give them and tell them to paste in the their drawing room. So that is very, very ideal in such type of a presentation. So child is having severe allergy, which when on and off exposure to allergens, and again child's immunomodulation is very, very essential. So in such condition, first treat the existing cold, then go for a course of Virechana, then start up with Rasayana like preparations of Farna and either Chavanaprasha, Haridrakanda, or any of these. You see, each of these Rasayanas are having many number of ingredients. So no need of adding 2-3 Rasayanas together. So one formulation itself is sufficient. Or as Reena Madam told, single drug Rasayanas I have missed completely in my slide. So the Pipali, you have Haridra, and you have Guduchi. These are all the Rasayanas which can be administered along with our compound formulations.
Sir, another question from Dr. Viresh Haveri, sir. Sir, Shwasakutar Rasa and Samirapanaga Rasa are arsenic formulations. Is there any side effects? How they are safe in children?
Yes, as I told earlier, Shwasakutara Rasa does not contain arsenic as far as my knowledge goes. But Samirapanaga, yes. Shwasakutara Rasa, long duration of administration causes knuckle hyperpigmentation and such type of adverse events I have observed when I was at Jamnagar. Later I didn't. But when you are giving it with Tambula, it is very good Maraka Dravya for many of these heavy metals. So it is very safe, and you can practice up to 1 to 3 months irrespective of the condition. And after 3 months, you should be cautious, and yes, there should be intermittent usage of it later on. So for 3 months, there is no problem, and we are giving it very frequently in children, and there are no side effects. And in children, we give half to 1 BD, depending on the condition. So if it is required, we say higher dose for 3 days, then reduce it. So such a way you have to modulate. Samirapanaga, actually I am not using it, so I will not be able to comment on that.
Okay, sir. Another one question by Dr. Savita Butale, madam. Children with cardiac disease will have often respiratory problems. Which drug can be used, which also acts as a cardioprotective?
So Arjuna and Pipali you can combine. Arjuna and Pipali you can combine, or you have Dashamula Haritaki preparations and Pravala Basma to that. So these are all the cardiotonic drugs. You can make respiratory formulations as cardiotonic by adding these preparations. For example, in CHDs, in minor VSD or ASD, nothing to worry. So, but if really child is compromising on the ejection fraction and all, there should be a continuous monitoring when we give these medications.
Sir, another question which is repeating from last session to this session also. Sir, what is the role of Swarna Prashana? Just now Reena madam told Swarna and Brakabasma best treatment in child.
Yes. Yes, obviously it is beneficial and it is very, very helpful. Again, you can practice it daily also for 1 month, 3 months, 6 months, 1 year. So daily practice of Swarna Prashana wherever it is possible is also more appreciable.
So another question, please suggest any Lehar Churna for the children not getting weight since not gaining weight since from 5 years.
not gaining weight. So there may be many. So if child is not putting, it is out of this discussion, but still, if the child is not getting weight, there may be many causes. One thing, child may not be getting nutrient, or child may be getting nutrient, or it may not be digested properly, or child may be digested also, but there is problem in the assimilation of it. So just one leha or another will not help the child, unless, because many things they might have tried if the condition is prevailing since long time. So evaluate the child. First start with the basics of Agni Deepana. First correct the diet habits and sleep habits of the child. Very important. Nowadays children are getting up at 9 o'clock or 10 o'clock, and parents are also happy that they can finish off their routine morning works while the child gets up. So very wrong practice, and make every child get up before 7 o'clock at least, and let the child pass stool and pass motion in regular timings. So if you do all these normal GIT functions normal, then your medicine will work better. So a complete evaluation is required, and that will help the child rather than simply giving any of the leha or other preparation.
Sir, another question, sir, from Dr. Sridevi, madam. Patient aged of 12 years male complaining of recurrent cold and cough with expectorant since 3 years. On auscultation, wheezing. What may be the treatment, sir? And again, they added, he has already taken the steroids but not got relief. Any suggestions, sir?
Yes, as we discussed, if you follow the principles of Tamakashwasa, take it from me that any patient of Tamakashwasa, since how many puffs of MDI he or she is taking, we can, with our Ayurvedic treatment, we can relieve them from all those interventions, and at least 6 months of time, if you have, you can relieve with the Ayurvedic treatments what I have explained in the presentation. But it should be methodical and under close monitoring. But during the treatment also there may be episodes of exacerbations. If one's child gets any infection, respiratory infection, this underlying bronchial asthma will surface out. So such exacerbations should not derail the treating physician or taking parents. So if you take care of these things, yes, child will be all right by within few months to a few years. So what I have explained in the slides, the same principle you have to follow, and that will help the child in overcoming from the asthma.
Another question from Dharmavir Kori. Sir, can you elaborate the importance and indications of Sukumara Prasha or Leha along with the Matra according to dose, according to age?
Reena madam will be the better person to answer this. Sukumara Leha or Prasha. It may be very similar to Kumara Bharana, or the preparation containing Swarna and immunomodulatory medicines. I think it is from SDM Bangalore or any other pharmacy. I am not sure the contents of Sukumara Prasha.
Madam is online.
Madam is online or?
Yes, online. Yes, ma'am. Yes, ma'am.
Sukumara Prasha. Of course, sir, it is a Swarna containing preparation. Yeah, much similar to the Lehanas explained. Of course, like Kumara Bharana Prasha, but it contains Kumara Kalyana Rasa. So, and of course, some of the Medya Grutas and Madhu is the content in that. So normally, for newborns, we start Sukumara Prasha as a Swarna Prashna Leha right from the birth. from the first hour of delivery, we introduce this Swarna Prashana to the children. So at that time, we introduce. So it is said that Swapandikala Matra is the dose to be given for the newborns. So anyway, which would come around 3 drops approximately. We normally say to give it as 1 pinch initially, but after after 1 month, after neonatal period, you can slightly increase the dose. 1 teaspoon you can give up to the age of 1 year, and after 1 year, if you want, you can double the dose, maybe twice a day. 1 teaspoon you can give. And above that, we normally advise that dose may not be enough for toddler age. So then we go for the higher doses. So it is a Anubhuta Yoga that is done in the STM teaching pharmacy, Bangalore. And of course, the Kumaravarna Prasha is also one which is done in STM teaching pharmacy, STM Hasan. So need not be these yogas. You can also formulate based upon these principles, and it could be started as a, which would also help. It is acts as a immunomodulatory yoga. At the same time, it could be a brain boosting thing also. Like Swarna Prashana benefits you can expect out of such yogas.
Thank you, madam. Thank you so much.
Hope I have answered the question.
Thank you, Kumar, sir.
Thank you, madam.
Thank you, sir.
So next question is, please advise some medications for the constipation in children below 5 years.
You have to first try to correct it without medicine. Let the child, as I told earlier, usually at this age, child is very likely to have habitual constipation. As the child is getting up late in the morning, then child is busy in playing, and the child withholds natural urge of stool. And then there will be solidification of the stool present in the rectum, and then it hinders further passage of stool. If you ask such patients, they will be passing initial pellet-like stools and then the semi-solid or sometimes loose stools. So this is the common thing, and avoid strictly the tandoori items or which are heated on the flame directly, like roti, chapati, and such type of things you have to reduce, and promote fruits like banana and papaya to the child in the empty stomach in evening. In evening, empty stomach around say 4 to 6 o'clock, and adequate water consumption you promote. So if it totally avoid biscuits and chocolates, especially these bigger chocolates like Dairy Milk, Munch, and all. If at all you want to give chocolates, at least manage it with the 50 paise chocolate. So that will not be causing much problem to the child. And such things should be practiced on the baseline. Then if at all the symptoms persist, yes, Sukumaragrita is first line. And then, so now before that you can manage with the Hingvastaka or Hingvastakavati and such type of preparations. And then Sukumaragrita. Then of course you can go with the Haritaki Kanda like preparations. And then if still not, then Avipatikara. So these are all the things, but it should not be permanent. You should make corrections in the diet and lifestyle, and for time being, these should be practiced. So in such a condition, always there will be complications like fissures. So in such condition, you can put a pichu of, just take a batti or the wick, which we use for puja, and dip it in Gandharva Hastadi Taila, and then insert to the anal orifice gently along with the good quality of earbud. Keep it overnight there. So it will help in relaxing the sphincter, anal sphincter, and next time when the stool passes, there will not be any injury. If fissure are there, then Jatyadi Taila Pichu is more beneficial to the child. So these two should be practiced regularly. So if constipation is very refractive and not at all managed by all these, then the Matra Basti or Matra Basti just of 2 to 5 ml of Gandharva Hastadi Eranda Taila at night and morning, the child will pass stool normally. Practice this for 1 week, then the child will be all right. All the Koshtagata Vata will be cleared and it will be all right.
Sir, another last question, sir, by Dr. Ashwini Bailey, madam. Sir, it is require Deepana Pachana before treating allergic URI. If such, what is the drug of choice for the Deepana Pachana?
You have to see for Amalakshana, and if it is purely Vatik, then no need of intense Deepana Pachana as such. But otherwise, if Amalakshanas are there, yes, then the best Deepana Pachana are Chitrakadi Vatti or Hingvashtaka Vatti. These are all the things what you can give. Or you can go with the Pipalyasava like condition, like medicines wherein you will be treating the allergic condition and also you will be dealing with the Deepana Pachana. So by the time allergic conditions come down, the child is always with the Deepana Pachana also over, and straight away you start with your Snehapana and the Shodhana procedures.
So last question in the chat box, sir. How to differentiate pneumonia from Kasa and Pratishyaya? Both have almost same symptoms.
Pneumonia is Shwasa. Pneumonia cannot be Kasa or Pratishyaya as such. But yes, at the severe form of Kaphaja Kasa, even the conditions of bronchopneumonia may be overlapping. So these should be considered. So Pratishyaya is totally different. Then Kasa and Shwasa, pneumonia is more equating or more correlated with the Shwasa rather than Kasa. But at the highest level of Kaphaja Kasa, there is chances of bronchopneumonia being associated. Bronchopneumonia may be the condition. So in such condition, you have to auscultate, you have to differentiate whether there is congestion, whether there is any reduced airflow. Yes, the best thing is you can go for a chest X-ray. So that will reveal the condition.
Sir, thank you so much, sir. By this end of all the questions in the chat box, sir. Thank you so much, sir, for calm interaction with all the questions and the queries in the chat box, sir. Over to Chandrasekhar, sir. Chandrasekhar, sir, audible?
Hello.
Sir.
Hello.
Yes, sir.
Okay. I could be thankful to the Dr. Nayan Kumar sir for your valuable time you are spending with our session, that is Bala Prana Raksha 2021. And thankful to all the HODs and lecturers from the different colleges, and thankful to all the students and practitioners across the Karnataka and India for your.
Sir, now I'm requesting Dr. S.S. Sangadi, sir, for the vote of thanks of the present scientific session held by the Dr. Nayan Kumar S. sir. Over to Dr. S.S. Sangadi, sir, Vice Principal, Sindagi Shantavireshwar Ayurvedic Medical College, Haveri, Karnataka.
So before going to end this session, my pranamas to Guru Dr. Srinivas Baniwal sir, Dean of Ayurveda Faculty, Rajiv Gandhi University of Health Science, Bangalore, and Principal, Sanjeevani Ayurvedic Medical College, Hubballi, for his direction, for his support to our college and all the faculty, and to be present with today's session. Sir, we are very heartful feel heartfelt thanks to Dr. Srinivas Baniwal sir. I am presenting my wholehearted thanks to today's resource person, Dr. Nayan Kumar S. sir, Associate Professor, Department of Komarbhritya, SDM College of Hassan. Sir has delivered a very nice, informative, good information on today's topic, approach towards cold cough and breathlessness in pediatrics. It was a very good session. It was a very interactive, and all the students, teachers, and all the Ayurveda fraternity has benefited from it. My special thanks to Dr. Reena Kulkarni Madam, HOD, Department of Komarbhritya, STM College of Ayurveda, Bangalore. Madam, very much thankful for being with us today's session and interacting over all the session. Very much good support from Madam in this interactive session. Thank you, Madam. We feel thankful to Dr. I.B. Kotrushetty sir, Principal, Rajiv Gandhi Education Society, College of Ayurveda, Roan, for being in this session today. Sir, very much thankful, sir. So Dr. Nagarajas, Principal, Ayurveda College, Malladalli, sir, was also present in this session. We are very much thankful, sir, to you. We are very much thankful to Dr. Arun Raj, sir, for being with us. Sir is also a faculty member at STM College of Ayurveda, Hassan. I'm thankful to Dr. MC Puranik Mat, sir, Dr. Purushottam, sir, the Dr. Dharamveer, sir, staff of STM College of Ayurveda, Bangalore. Thank you all, sir. I am very much thankful to Sri Anuruddh CR, Convener, Jignasa Karnataka. Thank you, sir. We are very much thankful to Sri Shivkumar BH, Coordinator, Jignasa Karnataka. Thank you, sir. We are very much thankful to Dr. Chetan Kumar, sir, staff of Taranat Government Ayurvedic College, Ballari. Thank you, sir. Dr. Virupakshaya, sir, from Davangere. Dr. Pushpa Adimani, madam. Dr. Akshay, sir. Dr. Pratika Bhatt, madam. Dr. Vijayalakshmi Benkatti, madam. Dr. Tasneem Donnur, madam. Dr. Jagdish Handigunur, sir. Sir, and all the, we are very much thankful to all the principals of all College of Ayurveda, the head of the departments, professors, teachers, PG and PhD scholars, and students of all Ayurveda college who had made the today's speech and today's webinar are successful. I once again thankful to all the resource person, all the dignitaries, all the professors, HODs, and who are the principals who were present in this session today. A special thanks to all the students of all the Ayurveda colleges who have been in this session today. Thank you one and all.
At the end, thank you once again to the organizers, and special thanks to our principal, sir, Sri Prasanna Narasimha Rao, sir, and our head of the department, Dr. Shailaja madam, for support and guidance. Thank you, sir.
So thank you so much, sir, once again. With the presence of all the eminent personalities in the Komarbhritya, it is happy to hold this scientific sessions in the Bala Prana Raksha 2021. It's a great pleasure to us have this session, very grand, successful, and more informative by the scientific view by the Dr. Nayan Kumar sir, and the more the opinion by the Dr. Reena Kulkarni madam. And once again, and thanks to all the dignitaries and participants. We are having WhatsApp group for the particular Bala Prana Raksha. It is open for the half an hour to all the participants. If any other doubts are, you can ask our today's resource person. I'm requesting Nayan Kumar sir for your valuable time. If any doubts is there, please clear with the WhatsApp group, sir. And we are having all the videos in the Facebook Jignasa Karnataka Facebook page, and also you are having this video in the Jignasa YouTube. And thank you once again, everyone. And tomorrow morning at 10 a.m. we are having our third session held by the Dr. Chandrasekhar KM sir. That is preventive measures in infectious disease with special reference to the respiratory infections in pediatric and Ayurvedic view. Stay tuned tomorrow at 10 a.m. I am requesting all the participants to make the tomorrow's events also more successful and informative. And followed by we are having grand valedictory functions. We are pleasure to have Sri Dr. Banigold sir, Dean of Ayurveda, Rajiv Gandhi University of Health Sciences, Bengaluru, as a chief guest for tomorrow's valedictory function. And we are happy to announce Dr. Shailaja Madam, HOD Department of Kaumara Bhrutya, STM College of Ayurveda, is chief guest for the tomorrow valedictory functions. And we are requesting more eminent personalities in Kaumara Bhrutya for the tomorrow's panel discussion about the whole sessions of the last 3 days. I am requesting eminent personalities of the Kaumara Bhrutya and eminent personalities in Ayurveda for the tomorrow's valedictory functions also. And once again, I am thanking everyone, and more for our HOD Dr. Chandrasekhar KM sir, and my beloved principal sir, and vice principal sir, and the whole faculty of our college, and more for the Jignasa team wholeheartedly supporting this session, make very successful and informative. Thank you everyone. By this we will end up the session, sir. Thank you so much, sir.